I'm glad you brought up education, because part of what we want to do with the website is, in fact, what we want to do, the mission of the website is to educate people. And we've been talking a lot about, I asked about preventable cancer because we've been talking a lot about lifestyle, how lifestyles, the changing lifestyles are affecting people.
Yeah, I'll interrupt you for a second. You know, we know that definitely lifestyle, diet, these things affect our overall general health. Probably our risk for prostate cancer as well. There have been some studies that show connections between diets that are high in animal fat and cholesterol, smoking, some of these unhealthy lifestyles and their association with prostate cancer and all cancers in general. I think for men who are just eating an unhealthy diet, not exercising, smoking, these men are at an increased risk for prostate cancer, and that's been shown. It's just the direct link is not as great as, say, with smoking and lung cancer.
Yeah, and I wanted to ask you, you talked about smoking earlier, and you talked about bladder cancer and so on. Because again, one of the things I want to do is have people make connections. Okay, so smoking goes to your lungs, but it also affects your bladder, your kidneys. So can you talk a little bit about those connections?
You know, when it's funny, 85% of people who develop bladder cancer have a significant history of smoking. There's a direct correlation there, and there's been some science to understand why people who smoke develop bladder cancer. When nicotine gets broken down in the blood, it gets broken down into another biochemical called acrolein. When acrolein gets filtered through the kidneys into the urine, it sits on the lining of the urinary tract, and over time it induces a malignant change or a malignant transformation in the lining of the urinary tract, and these malignant tumors develop. So it's a byproduct of the nicotine that gets into the urine that induces tumors in the urinary tract.
Yeah.
It's more complex than just putting the smoke into your lungs. It's the way that the byproducts of the cigarettes get into our whole system, into our body.
Yeah, people don't make those connections.
No, they don't. You know, it's smoking. You know, this is just one way smoking affects our body. Another way is, you know, the nicotine in our blood damages the lining of the blood vessels. When you damage blood vessels, now our organs won't receive blood and nutrients as well. This is where smokers end up with, you know, kidney disease, you know, liver disease, disease of the vascular disease that affects their heart, vascular disease that affects their extremities, vascular disease that affects their sexual function as well. I mean, you know, I see young patients who are otherwise healthy who have been smoking a pack a day for 10, 15 years, and their only health problem is they have erectile dysfunction. It's because the smoking over all these years has affected those blood vessels that supply the genitals for proper sexual function. Same thing with diabetes. Diabetes, just like as smoking affects the blood vessels, chronically elevated blood sugars affect the blood vessels and nerves that our organs need to function properly. Diabetics, in the same way, are at risk for erectile dysfunction because of their chronically high blood sugar levels. Now, a diabetic who smokes, now, you know, he has double risk, and that's something we often see. 35, 40-year-old gentleman who has diabetes for about 10 years has been smoking, and is having major problems in the bedroom.
Yeah. So what is it, doctor? How do you get your patients to make the switch? Because people with diabetes, for example, and men know this. Men know that their doctors tell them this. This will happen eventually, but they don't make the lifestyle change that could prevent that. They don't manage how they eat. They're not careful, and I want to also talk about the alcohol, how alcohol affects the body, because one of the issues in the Caribbean, we think a lot of alcohol.
Yeah, I mean, the same way that you know, smoking affects the blood vessels and the high blood sugars affect the blood vessels, chronic alcohol intake does the same thing. Chronic alcohol intake affects not just our vascular system, but it affects our liver as well. And we, you know, our liver is a very complex organ with enzymes that we need to break down toxins in our body. So if our liver is not functioning properly, we get a buildup of toxins in our body that are harmful. You know, I think the most important thing with patients is to talk to them, not too technically, and to be very straightforward with people. You know, I talk to my patients the same way that I'll talk to my friends or my family, and I'll let them know, look, you're hurting yourself with these things. You know, I'm here to help you, and it's not easy. But people need not just a doctor, they need a coach. And I always tell people, I'm your doctor, I'll prescribe you medications, but I'm your coach too. We're here to have a conversation, and I'm here to give you the kind of psychological and emotional support you need so you can do the right things, change your lifestyle, and get healthier. The smoking, the diet, the alcohol, these are things that people need to control, and they need to find some moderation. They need to find a healthy approach, and very often it takes support to find that moderation. And I think just going to see your doctor a few times a year, getting that mental support, and getting that coaching, so to speak, can help.
Yeah. And the other side of that is when we're talking about lifestyle changes. One of the things, I work a lot with women, and so my questions come back around to women. In the Caribbean, my experience has been, and still is, men reluctant to go to the doctor. Often it's the wives and the mothers and the sisters who push them and make them go, and also often it's those women who are responsible, quote unquote, for how these men eat, for helping them to eat. And I've seen men resist. Oh, she's gonna feed me salad. I want. I've seen them resist that.
Sure.
They want the beer. They want to drink 5 beers on Saturday afternoon with their friends. Sure. And there's the wife or the mother who nags and says no. So what advice would you have for women who have to, who are concerned?
I think you need to continue to be that nag, and it's what you're saying is true. A good number of the men who come to see me get dragged in here, by their elbow, by their wives or significant others. Getting back to what I was saying before with the support, I think a partner gives that lifestyle support that you need, and it's got to be encouragement too. It has to be very encouraging, and you have to constantly be reminding patients of the potential dangers of not doing the right things and not living a healthy lifestyle.
Yeah.
Okay. I'm not saying don't drink at all. Drinking alcohol is something that keeps us happy. Having a glass of wine a few times a week actually is not a very harmful thing. But when you're going home and you're drinking a 6-pack of beer or a whole bottle of wine every night, this is when we start to run into trouble. We need to once again find that moderation. But we definitely need to have a support structure at home, and the spouses and the significant others play a huge role in men's health, keeping men healthy.
Thank you very much. I don't want to increase women's responsibility, but thank you very much, because it's important as parts of families and countries and
sure.
And so thank you very much,
You're welcome.
Dr. Bruck.
You're welcome.
Thank you. We'll be importuning you again.
All right, I'm here. I'm happy to do it. Love doing it.